In today's video, we are going through often repeated questions on the musculoskeletal system. For the first question we have, which of the following bones is a part of the axial skeleton? A. The humerus, B. The femur, C. The scapula, and D. The sternum. You can go ahead and pause this video to guess your answer. The most correct answer here should be D. The sternum. The axial skeleton includes the skull, the vertebral column, and the rib cage, which includes the sternum. Then the humerus and the femur and scapula, on the other hand, are parts of the appendicular skeleton. Question number 2. The most abundant type of cartilage in the human body is A. Elastic cartilage, B. Fibrocartilage, C. Hyaline cartilage, and D. Articular cartilage. The most correct answer here should be C. Hyaline cartilage. The hyaline cartilage is the most common, and it is found in the nose, the trachea, and in articular surfaces. Question number 3. Which muscle is responsible for initiating abduction of the arm? A. The deltoid, B. The supraspinatus, C. The infraspinatus, and D. The trapezoid. The most correct answer is B. The supraspinatus. The supraspinatus initiates the abduction, and then the deltoid muscle takes over. Question number 4. Which of the following is not a feature of skeletal muscle? A. Multinucleated cells, B. Voluntary control, C. Intercalated discs, and D. Striations. The most correct answer is C. Intercalated discs. Intercalated discs are present in cardiac muscles and not in muscular muscle. Question number 5. Osteoclasts are derived from A. Mesenchymal cells, B. Osteoblast, C. Monocyte macrophage lineage, and D. Chondrocytes. The most correct answer is C, which is monocyte macrophage lineage. Osteoclasts are multinucleated cells, and they are derived from hematopoietic stem cells. Question number 6. Which of the following joints allows for the greatest range of movement? A. Hinge joint, B. Pivot joint, C. Saddle joint, and D. Ball and socket joint. The most correct answer is B. The ball and socket joint. The ball and socket joint actually allows a very wide range of movement along its axis. So example is the hip joint and the shoulder joint. Question number 7. A fracture of the surgical neck of the humerus is most likely to damage which nerve? A. The axillary nerve, B. The radial nerve, C. The ulnar nerve, and D. The musculocutaneous nerve. Most correct answer is A. The axillary nerve. The axillary nerve winds around the surgical neck of the humerus, and this may be injured in fractures. Question number 8. What is the primary mineral stored in bones? A. Potassium, B. Phosphate, C. Calcium, and D. Sodium. The most correct answer here should be C, which is calcium. The bone serves as a reservoir for calcium, and this is crucial for muscle contraction and nerve function. Question number 9. The most common site of osteomyelitis in children is A. Diaphysis, B. Epiphysis, C. Metaphysis, and D. Articular cartilage. The most correct answer is C. Metaphysis. The metaphysis of long bones has a rich blood supply, and this favors infection. Question number 10. Which hormone stimulates the osteoclast behavior? A. Calcitonin, B. Estrogen, C. Parathyroid hormone, and D. Growth hormone. Most correct answer is C, which is the parathyroid hormone. The parathyroid hormone increases blood calcium by stimulating osteoclast-mediated bone reabsorption. Question number 11. The patella is an example of which type of bone? A. Irregular, B. Long bone, C. Flat bone, and D. Sesamoid bone. Most correct answer is D. The sesamoid bone. Sesamoid bones are most times embedded within a tendon, and patella is actually the largest of the sesamoid bones. So have that in mind. Patella is an example of the sesamoid bones. Question number 12. Which protein is responsible for elasticity of muscle? A. Actin, B. Myosin, C. Tropomyosin, and D. Titin. Most correct answer is D. Titin, because titin spans from the Z line to M line and they provide passive elasticity to muscle. Question number 13. Which type of epiphysis is found at the head of the femur? A. Pressure epiphysis, B. Traction epiphysis, C. Atavictus epiphysis, and D. Aberrant epiphysis. Most correct answer here is A. Pressure epiphysis, because pressure epiphysis contributes to joint formation and bears weight. Question number 14. In rheumatoid arthritis, which joint is typically involved early? We have A. The distal interphalangeal joint, B. The proximal interphalangeal joint, C. The first carpometacarpal joint, and D. The hip joint. Most correct answer is B. The proximal interphalangeal joint. Rheumatoid arthritis are actually most times involved in the proximal interphalangeal joints and also the MCP joints, and sometimes it spares the distal interphalangeal joint. So have that in mind when you think of rheumatoid arthritis, which is early rheumatoid arthritis. Think of its involvement in the proximal interphalangeal joints and the MCP joints. Question number 15. Which vitamin is essential for proper collagen synthesis in bone? A. Vitamin D, B. Vitamin A, C. Vitamin K, and D. Vitamin C. Most correct answer is D. Vitamin C. Question number 16. The periosteum is A. The inner lining of the bone marrow, B. The outer fibrous layer of bone, C. Only found in long bones, and D. The cartilage covering joint surfaces. Most correct answer is B. The outer fibrous layer of bone. The periosteum is a vascular connective tissue layer covering the bone except for articular surfaces. Question number 17. Which bone cells is primarily responsible for bone formation? A. Osteocytes, B. Osteoblast, C. Osteoclast, and D. Chondrocytes. So the most correct answer here should be osteoblast, because osteoblasts actually secrete bone matrix and are responsible for ossification. Question number 18. What is the primary type of collagen in bone? A. Type 1, B. Type 2, C. Type 3, and D. Type 4. The most correct answer here is A, which is type 1, because type 1 collagen is the major component of bone matrix and they provide tensile strength. Question number 19. Genu varum is characterized by A. Knock knees, B. Bow legs, C. Flat feet, and D. Club feet. Most correct answer is B, which is bow leg. And this is because the genu varum are actually characterized by the knees apart, the ankles together, and it gives a bow-legged appearance, which is unlike genu varum. Question number 20. Which muscle is involved in the unhappy triad knee injury? A. The bicep femoris, B. The sartorius, C. The semimembranosus, and D. None. It is actually ligamentous. Most correct answer is D, which is none. It is ligamentous, because the unhappy tride involves the ACL and the MCL, and also the medial meniscus. So it is not actually a muscle injury. So our most correct answer here should be D, which is none, and then it is ligamentous. So there you have it, 20 questions on the musculoskeletal system. I hope you enjoyed it, and I hope you subscribe for more content like this. See you in the next one. Bye.